I firmly believe that testing teaches pathophys. It seems a really straightforward concept to me, and yet it teaches really poorly. I do what I think is this really clear explanation, and the students can't follow it. So I think I'm going to take some time and repeat it a number of times with a number of different pathophysiologies until I find out how to better get through this idea. There's no better example than to take congestive heart failure. Left ventricular congestive heart failure is common, it's a common end pathway, and we have lots of ways of diagnosing it because it's been around a long time, so you can sort of use it to follow the evolution of testing. So let's do congestive heart failure and see if you can understand why S3s and crackles are proof because they're steps of the pathophysiology. Testing teaches pathophysiology. Before we begin, if you haven't already, please subscribe. Every week I post a new video helping you learn to think like a doctor. For those who are new here, I'm Dr. Philip Tisdall. I practiced for decades, fell hard in love with teaching about 12 years ago, and I've been teaching full-time ever since. You've often heard me say that testing teaches pathophysiology. And what I mean by that is a test diagnoses a disease because it shows you the step in the pathology that is an integral part of that disease. And this seems to be an easy concept to me, but it turns out it's not an easy concept to teach. So today I want to explore it using congestive heart failure as an example. So let's start with how we see the heart. So I'm going to do my standard heart way on a long axis ultrasound. And now, because we're doing congestive heart failure on the left side, I'm going to back it up through my pulmonary veins until I get to an alveolus. Now, let's walk through the pathophysiology of heart failure, be it ischemia, valves, hypertension. It's a common end pathway. The first thing that we're going to see is an increase in sympathetic nervous system when the blood pressure starts to drop. That's not measured. The next thing we're going to see is remodeling as we get the hypertrophy of the heart. So now we're going to get a bigger heart. And when that's inadequate, we're going to go into failure. Now, I'm going to define failure clinically. Failure is an increase in end-diastolic volume and/or pressure. If that's the definition of failure, then any test that shows that proves that it's failure. So let's follow that back. There is my increase in my left ventricle of end-diastolic volume and pressure, and that backs up into my left atrium. That pressure continues to get transmitted down the pulmonary veins, and when it is greater than 20 millimeters of mercury as a reference point, we see pulmonary edema. And this is when your patient is going to develop shortness of breath. So let's flip the script now. The patient presents with shortness of breath. Organ systems, heart, lung. If it is heart, it is left ventricular congestive heart failure. So any test that shows an increase in end-diastolic volume and/or pressure is going to show that your shortness of breath is from this. So let's go through the ways we can do it. Supposing I give you the physical exam. Well, there are two things that you can do with your stethoscope. The first is you can show that there's pulmonary edema because there's going to be crackles. And the second thing you're going to see is when a left atrium contracts into a dilated left ventricle, we get an S3. So crackles and S3 show that there's an increase in end-diastolic volume and/or pressure and therefore diagnose congestive heart failure. The second thing I could give you is a chest x-ray. And now what we're going to see is these findings. Here's my chest x-ray. Look how fast I can draw it. It's not how good it is. It's, do you see it in your mind's eye? So I'm going to see cardiomegaly and I'm going to see pulmonary edema. Now, there's a third thing you can see. I didn't show it in this picture, but this edema actually goes all the way through the bronchial tree as you come up. And if those go along an interlobular septum, you can also see them here as curly B lines. So when I say chest x-ray, you're going to look for one, cardiomegaly is evidence of remodeling. We can see the congestion here in the perihilar regions and increased vascular spacing. So that's going to be evidence of pulmonary edema. And then we can see our curly B lines as it goes up the tree. So that's pretty good. The next thing I could give you is supposing we had a test that showed pathologic stretch of the myocyte. So that would be, here's my myocyte with increased stretch, and that's going to be my natriuretic peptide. So I could do a brain natriuretic peptide as evidence of left ventricular stress and stretch. It's a really good test, of course. And then the last thing I could do is I could use an echo. Now, echo, of course, is going to be great for structural defects, valves, hypertrophy, all those. That'll be excellent for that. But the other thing it's going to give me is an ejection fraction, because that is going to allow me to see if it's less than 50%, then I have heart failure with reduced ejection fraction. So, very briefly, you can see that testing teaches pathophys. If you have the pathology in your mind's eye, then you say, what test proves a step of that? And that's the basis of all really good tests. So when you're learning your pathophysiology, always explore the testing and ask, why is that test such a good test? Because it's going to teach you pathophysiology. Just a point of clarity, you notice our name is Medical School Companion. We're not a medical school, so we presume you're bringing basics to us, and we're going to show you how to use all the things you're learning in your medical school and organize them in a way that's patient-centered, in which clinical medicine is built on a foundation of basic medical sciences. We're here to help you learn by organizing what you're learning clinically. If you think this way of learning medicine is helpful, there are two ways to study with me. First, you can purchase my textbook. It's basically my brain in pathophysiology. Second, you can join our community. And in that community, I'm going to be teaching live online, and you can interact with other students who think like we do and me. For more information, click the links in the description. If you want to watch my earlier video on testing teaches pathophysiology, you can see it right here. See you next time.